My name is Ashley Stedman, and this is my community assessment project on Spanish Fork City, Utah, in Utah County, Utah. Spanish Fork is located in the south central area of Utah County. It is nestled along the edge of the Wasatch Mountain Range, which lies on its eastern side, and it has easy accessibility to Spanish Fork Canyon by Route 6, and the Spanish Fork River runs right through town. Spanish Fork can be described as having a mix of small town suburban homes and rural farmland. In the 2010 census, Spanish Fork had a population of about 35,000, and according to the census, there is an estimated 15% increase in population since 2010. It was 84.4% Caucasian, 11.2% Hispanic, and less than 5% other ethnicities, again according to the 2010 demographic census. For economics, the Spanish Fork area's median income per household was almost $75,000 as of 2018. Most residents are considered living in middle class or higher middle class, with 6.9% of the residents living below the poverty line. For government, it's a mayoral government. They are in office for 4 years. Our current mayor, or Spanish Fork's current mayor, being Steve Leifson, Chief of Police Stephen Adams, and the Utah State Governor currently being Gary Herbert. For our last voting statistics, Utah voted in at 50.2% a Republican Party, 34.8% an Independent Party, and 14% Democratic. Education. Spanish Fork has one high school, and then there are 2 junior highs, Spanish Fork Junior High and Diamond Fork Junior High. Spanish Fork has over 5 elementary schools and has a technological college, so Mountainland Applied Technology College. For recreation, there is a walking trail, which is estimated to be over 6 miles long, that follows the Spanish Fork River. There is a large rodeo ground, again easy access to Spanish Fork Canyon where there are ATV trails and hiking trails. There's the Spanish Fork Reservoir, which has a imported beach sand on one side of it for people to go swim. There is a public library that is surrounded by a large park and a large recreational area which has baseball fields, softball fields, soccer fields, pickleball courts, tennis courts, and other fields for sporting events. There is a lot of opportunity for these sporting events and outdoor activities, which is what a lot of people say draw them to the area of Spanish Fork, is again just that accessibility to all of these different kind of sporting and outdoor activities. The problem that Spanish Fork faces is substance abuse, with the city coming in the highest in Utah County for abuse of prescription opioids and illicit drugs. In 2017, according to the Center for Disease Control, Utah had a drug overdose death of 22.3%, which is higher than the national average at the time of 19.8%. In fact, Utah has been in the top 10 states for the last 10 years for opioid-related deaths. In order to combat this, Healthy People 2020 has a goal to reduce substance abuse to protect the health, safety, and quality of life for all, especially children. They propose doing this by lessening the exposure of drugs and alcohol to children and to increase the perceived risk by children to drugs and alcohol. Utah community goals include increasing awareness of the problem, increasing accessibility to treatment, and educating the public on overdose prevention and treatment. Resources available in Spanish Fork is New Haven, which is an inpatient rehab facility for adolescents that have substance abuse and behavioral disorders. There are 2 outpatient rehab facilities and 3 detox or long-term rehabilitation centers for adults. There is a Revere Urgent Care and a new Intermountain Hospital that is scheduled to be finished in the fall of 2020. Community-based interventions include during the summer months, Spanish Fork City has food trucks, games, and events held at the local park, which surrounds the city's library. Many residents attend these events as they have become widely popular over the years. Our proposed intervention would be to hand out flyers at street crossings containing information on drug rehab facilities and having short announcements made between events for intervention hotline numbers and financial resource numbers. The outcome of these small interventions would be to get basic information out to the public that will help start the process for early education and prevention. To evaluate the outcome of this kind of intervention, I would hope to see a greater rate of those residents abusing substances seeking treatment, with at least half of those abusing starting the rehabilitation process. This in turn would hopefully decrease the number of substance-related deaths, ideally well below the national average. In conclusion, in order to decrease the number of drug overdoses and abuse, the goal is to create a community awareness of the issue and promote the education of the resources that are available to its citizens. If small steps can be made towards awareness, more goals can be made towards prevention and community health achieved.